Hi, I'm Dr. Nitesh Patel, a GP working here at 21D, and today I wanted to talk to you about anxiety. Now, mental health is an ever-growing problem, and actually it equates to over 50% of our consultations as a GP. And the most common of the two are anxiety and depression. Today, I'll focus a little bit more on anxiety, and I'll make another video that has a little deeper dive into depression. Now, the first thing I want to say is anxiety is completely normal. If humans didn't evolve to be anxious, we would have died out. And that's purely because anxiety forms part of our what we call fight or flight response. That means that back in the day, we could run away from predators. But these days, we tend to need to do that a little less often. But our body still has that anxiety within. Now, we all know when someone scares us, we suddenly jump and you can feel your heart racing, your mind going, and you just feel really nervous on edge and you hate that feeling. But that's the feeling of someone who's really anxious. They actually have that feeling all the time. And the common symptoms of that are hands trembling, heart racing, feeling sweaty. You can get diarrhea, you can get tummy ache, you can get headaches, all from being anxious all the time. This amount of anxiety will cause you to feel really tired if that adrenaline does settle down, because your body's always in that fight or flight mode. Now, anxiety is a scale. Like I said, everyone has anxiety, it's normal. But it depends on what level your anxiety is. Some people have a background of very low level anxiety where it doesn't affect them on a day-to-day basis. And then the opposite end of the spectrum is where people think and worry and overthink about every little thing they do. And actually that may end up to catastrophizing things. So thinking, if I don't do this, this will happen, this will happen, this will happen, to where ultimately a very improbable thing would happen. Maybe even an impossible thing, but it's still something that you will worry about. Now, some things we worry about aren't in our control, but that's difficult to let go of as well. But it's about realizing that some things aren't under our control and that we just have to let certain things happen. For some reason, one of the examples that springs to mind is when, a mom sends their child off to university. They're worried about their child and what's going to happen to them and all those kind of things. But at the end of the day, whatever's going to happen, they can't control, and most of the time they're going to love uni and have a great time. But still, that thought about the worry. Another element of anxiety may actually result in panic attacks. Now, this is where the worrying actually starts to affect your breathing, and you start to breathe short, shallow breaths. You can also get heart palpitations or your heart's racing. You may even feel lightheaded and dizzy as well. It might even feel like you're having a heart attack, and it can be very difficult to stop as well. But I'll come on to different ways to kind of help you in just 1 second. The main issue is just understanding your own anxiety, and if there are any particular triggers for yourself. Now, no one can really do that. But one good way is just writing down whenever you feel particularly anxious and what's caused that. And if you write it down, you will always be able to look back at that and go, I understand that that's one of the triggers of my anxiety. And from this, you can find ways to help reduce that anxiety. So yes, there are medications. Of course there are medications, but medications aren't the be-all and end-all. There are other ways that you can try and help, one of which is talking therapies, trying to find the root cause of the anxiety and actually working out good strategies. There are self-help books for this, many of them out there, that help to give you strategies. Now, obviously, each strategy is different and everyone is different. So something that works for one person won't necessarily work for another. But there is always something that can help. Practicing mindfulness, and I will talk about mindfulness more in a different video, but being able to control your mind and actually also control your breathing and taking long, deep breaths, whether that be counting to 3 in, obviously slowly, going 1, 2, 3 won't help. Maybe throwing in a Mississippi in between them might help. But in and out, nice and slowly, controlling your breathing and focusing purely on your breathing and not what's going on will really help with anxiety, and particularly actually with panic attacks, because one of the things is the short, sharp breathing. Slowing that down and being able to just focus on the air going into your body and the air coming out of your body is very important and can really help. And finally, there are many supplements out on the market that are advertised to help with anxiety and things. Now, I've personally not seen all the research for them, so it's difficult for me to say any particular supplements, but you may find that they help. Again, everyone's individual. I hope this video has helped you today. Thank you for listening.